No? Hello, my name is Ava. I'm going to be one of your nurses for today. I'm just going to go over the diagnosis with you that the doctor has diagnosed and make sure you don't have any questions for me. Does that sound good?
Yes.
Okay. All right, before I keep going, do you mind verifying your name and your date of birth for me?
Koda conduct 12/2 of 70.
Okay, perfect. All right, so you were diagnosed with pyelonephritis, which just means that there's going to be an infection in your kidneys. So it is most likely caused by bacteria, and it most likely started in your bladder and traveled up to your kidneys. So this can be serious, but since we got you here, we're treating you, we'll take care of you. So let's see, about 1 in 2,000 people in the US get pyelonephritis. So it's not super common, but it's not super rare either. So I wouldn't be worried. All right, so for some risk factors for this is going to be diabetes, hypertension, autoimmune disorders, any blockage of the urinary tract. And then, so what you might be feeling or seeing in yourself right now is going to be some fever, chills. Do you have any pain in your flank?
Yes, I've had a little bit of lower back pain just recently.
All right, so that's another sign of this infection. So you might also feel some pain while you are urinating. You might need to urinate more frequently, and then you might also see some cloudy urine or blood in your urine. Okay. All right. So to diagnose this, or just to monitor this infection, we're probably going to be ordering some tests. So that would be a urinalysis, a urine culture, a complete blood count, and a complete metabolic panel, just to look at your lab values and monitor your progress through here. We might also be doing a CT scan and maybe a renal ultrasound, just to get images of your kidneys. Let's see. So for your treatment, we're probably going to get you on some antibiotics. I'm pretty sure the doctor's ordered that for you. That'll help you get rid of the infection, make you feel better. So we'll get you on that. And then I would recommend, to prevent this from happening again, I'm going to recommend that you drink a lot of fluids, that you stop smoking, because I know that's hard to break, but it is something that contributes to this disease. And then whenever you do go to the bathroom, I want you to empty your bladder completely. Don't try to hold it in, because that will help cause this too. And then I also want you to pee before and after having sex, and just practice some good hygiene. So that means maybe showering regularly or changing out your underwear pretty regularly. Just keep yourself clean so that bacteria doesn't travel up your urethra.
Okay.
Does that make sense? Do you have any questions for me?
I'm really craving a cigarette.
Well, I'm sorry, but we're in the hospital right now, so I can't get that for you. But
Is there anything you can do for me?
I might be able to look into getting you a nicotine patch.
Okay, I would appreciate that.
Sure, I'll look into that.
Okay, thank you.
Yep, and it looks like the next nurse is here to do the care plan, so I'll leave you in her care.
Okay, thank you.
Hello, my name is Jade, and I'm going to be one of your nurses today. We're going to go over your care plan.
Okay.
Can you tell me your name and birthday?
Koda conduct 12/2 of 70.
It's nice to meet you, Koda.
Nice to meet you too.
I'm going to go over some information about what we're going to do for you today, okay?
Okay.
So we were pretty concerned about some of your vitals, and especially that fever was looking pretty high. And then you said you were having some pain.
Yeah, just a little bit like in my lower back.
What would you rate that on a scale of 1 to 10?
Like a 4. I feel like it's kind of tolerable and it kind of comes and goes.
Okay, yeah, we're gonna get you some medication for that to reduce that pain. We're also gonna get you something to reduce your fever to make you feel a little bit more comfortable.
Okay.
And we have an antibiotic, so we're pretty concerned about that infection. And we're gonna get that administered to help get rid of that infection and get you feeling better.
Okay.
And we do also want to, by the time you're discharged, have your lab values back within normal ranges, because your BUN and your creatinine were pretty high. So,
What does that mean?
So those are both for your kidney, and your BUN is supposed to be within 7 to 20 milligrams per deciliter, and it was at about a 30. So we want to get that back down within normal ranges before we discharge you.
Okay.
And we did also want to talk to you about your smoking. We do want to recommend that you quit smoking. this that can inhibit your ability to heal from these types of infections. Do you have any questions for me?
I think I was supposed to be getting a nicotine patch because I'm craving a cigarette, but I know I can't smoke in here, so.
Right. Yeah, we can go ahead and get you a nicotine patch, or we can look into making sure you're able to have one.
Okay.
Is there anything else I can do for you today?
I don't think so.
Okay, perfect.
Thank you.
And it looks like they are coming to talk to you about your medications right now.
Okay.
Knock, knock. Hey.
Hi
I'll have
again.
you confirm your name and birthday for me one more time.
I'm Koda Conduct, 12/2 of 70.
Perfect. It looks like we just got a new order for a catheter, which we're going to insert that up into your bladder to help drain it out.
Is that going to be a painful process?
It shouldn't be painful. It's not going to be comfortable, but once we get that in your bladder and it drains, it should help with that feeling of needing to go.
Okay.
So
Makes
it should
sense.
be making you feel a little bit better and hopefully help with that infection.
Okay. Thank you.
Hi,
Hi.
my name is Maddie. I'm one of your nurses for today.
I have a lot of different nurses today.
I know you do.
It's kind of overwhelming.
It is.
Yeah.
Well, I think we only have a few more people coming in, and then we'll give you some privacy, okay?
Okay.
I'm gonna check your name and date of birth. Can you just verify that for me?
I'm Koda Conduct, 12/2 of 70.
Okay, and then do you have any allergies?
Cats, and I don't like cats.
Oh, I'm sorry to hear that.
Just don't bring any cats in my room and we'll be good.
I'll make sure not to.
Okay.
Have you ever had penicillin before?
Yes, I have.
And did you have a reaction to it?
No.
No? Okay. Well, I'm just here to go over your medications with you. Right now, the doctor wants you to have heparin and ceftriaxone. So I'm just going to kind of go over what those are for you before they bring them in here later today. So heparin is a blood thinner. So they're going to give that to you via a shot. They're going to put it in your abdomen. So what that does is since you're in the hospital, it's just going to thin your blood to make sure that you don't have any blood clots. We are going to take some labs since you're taking that medication. We're going to take an activated partial thromboplastin time. We're going to do that 6 hours after your first dose, and then after that, we'll only take it every 24 hours.
Okay.
You're already getting a CBC ordered and then your BUN, so we'll just keep up to date with those.
Right.
And then I don't anticipate an INR being done, but your doctor may want one for that as well.
Okay.
What I'm going to have you do is I need you to avoid vitamin K rich foods. So that's anything like broccoli, cabbage, and spinach. And that's just going to decrease the effectiveness. So we're just going to steer clear of those so that way it is effective for you.
Right.
Okay. And then your other medication is an antibiotic, and it's used to treat bacterial infections. We're using it for you for your urinary tract infection. So when we give it to you, just because it does have penicillin, we'll just monitor you for any allergic reactions. And then we'll also just monitor that BUN and creatinine. And then we're gonna also take a look at your CBC to just make sure that your blood cell counts are within a normal range. And this will be going through your IV, so she'll come in and just hook it up through your IV that you already have. And because it is an antibiotic, we'll wanna make sure that you get the entire dose on time. So we'll just make sure that that's running continuously until you're done with the treatment.
Okay.
Do you have any questions for me?
Will I still be able to like take pain medicine with these medications?
Yes,
Okay.
and the pharmacy will be verifying everything that you get to make sure that there's no interactions. So whatever gets prescribed, they'll verify all of that for you.
Okay. Sounds good.
All right, well, it looks like someone else is here for you. I'll
Okay.
see you later.
Thank you.
Okay, knock, knock, knock. Hi, Mr. Conduct. My name's Caitlin. I'm gonna be your nurse and start your...
Another different nurse.
Yeah, we're a big
Oh,
team.
man.
So I'm just gonna
Okay.
be inserting your catheter. Did someone come by and tell you about that?
Briefly, yeah. I'm nervous though because I've never had one.
All right, so it's just gonna be a hollow tube that's gonna go through your urethra up into your bladder to drain the urine because there was a new provider order saying that if your post-residual volume, which is the urine still left in your bladder after you urinate, was 400, you would need a Foley insertion, and your residual volume was at a 500. So that's what we're gonna be doing today. It might feel a little uncomfortable, but it shouldn't hurt.
Okay.
Do you have any questions?
No.
Okay. So first I'm just gonna start by pulling back your sheet, okay?
Okay.
Okay, so we're just gonna start with your perineal care, okay? I'm just gonna put your legs up. And then I would have gloves on. I would wash the tip of your penis in a circular motion going down to your anus.
Maybe rather than you guys send like
Alright, now I'm just gonna drape your penis.
when should I call the physician? When should I call the physician?
So now I'm just gonna start with cleaning the tip of your penis. It's not the top for me. So I'm gonna start in the center and work my way around, okay?
Mr. Gonzalez, he is Hispanic. He's a Hispanic male. Okay, sorry. Go back. Are you ready?
Alright. Now I'm just gonna gather the catheter in my hand.
Good. That's good.
And I'm just gonna start to insert it. Okay, now I'm just gonna fill up the balloon.
Heartbeat, or heart rate, stage 2 hypertension, 160 over 96, for the respiratory rate.
Right, and then if this were a straight cath, I would let the bladder drain and take the catheter out, but since this is a Foley, I'm just gonna leave it in, and then you might feel the urge to void, but you will be voiding into the catheter. And then if you notice any bleeding or pain or discomfort, please use your call light, let me know, and then I'm just gonna clamp this to your side of your bed, okay? And I wait date, time, and label the bag.
Hi, Mrs. Conduct. I know you've been having some concerns about a few different things lately. Can you kind of tell me what you're like feeling and experiencing?
Yeah, I'm just really concerned about how we're gonna pay for everything because we just don't have a lot of money right now, so I'm really concerned about the cost.
Right. No, I totally understand that. I have a few community resources that I want to put you in contact with. The first one being Hunter Health. It is a community resource for those that are part of a Native American tribe, and also within your tribe. I would explore further into that. There's always benefits that can help out with financial costs and costs of healthcare and things like that. But for Hunter Health, it provides comprehensive healthcare, dental, behavioral health, immunizations, federal and local resources, all kinds of health programs that might be beneficial to you as you navigate through paying for these expenses that you were not expecting to have to pay for. So I can get you in contact with them in order to navigate those struggles that you've been experiencing lately. And then we also have an order that he might potentially be going home on cath care, like with a catheter, and I know that can be really difficult to navigate through. So I want to get you in contact with someone, some local home health. You guys are from Ponca City in Oklahoma, right?
Yeah.
Okay, so I've done a little bit of research, and I want to get you in contact with Precision Home Health. We can have somebody come out and allow you to, learn through them, learn with them, and then they can come by weekly to just check and make sure that everything is going as planned. So I'll get you in contact with them as well. They are on call 24/7, so if there was any sort of emergency where you're at home and you don't know what to do, they're always there for you, and they would be really beneficial as you navigate through going home on catheter care and with education as well.
Yeah.
So I'll get you in contact with them, and I really wish you the best.
Thank you.
Of